Hello, class. So now we'll be talking about the signs and symptoms of hepatitis. So after a short incubation period, the virus or the hepatitis will move into one of three phases. The first one being the prodromal or preicteric phase. Patients in this phase are still can transmit the virus to others, but they'll also present with generalized fatigue and malaise. They'll be weak. They can have a fever. Nausea, vomiting are also signs that are associated during the prodromal phase, and it doesn't really culminate until jaundice appears. And this is the yellowing of the skin, the oral mucosa, the whites of the eyes. So after this, we can then move on to the icteral phase. This is the acute phase of the injury or of the infection, and patients will uh, typically have dark urine. They'll have clay-colored stools, and this is usually due to the lack of bile salts. And in regards to this one, during the inflammatory response, um, the liver can cause cholecystitis by blocking the bile ducts. So this can also lead to bile salt accumulation under the skin, leading to severe itchiness. Um, Patients will also they'll also have an enlarged liver that is tender to the touch. Similarly, splenomegaly can also be present. After the acute phase, the patient will then move on to the recovery phase, in which the jaundice will typically clear, and liver function will return after about 2 to 12 weeks. But during this time period, lab results will indicate elevated serum enzymes that we'll be talking about later on in this discussion. Um, Lastly, the liver will remain enlarged for a while and will remain tender. Um, and then in regards to patients with hepatitis B, C, and D, they can have chronic hepatitis as the virus doesn't clear out as over time. And so the patient will have the same signs and symptoms of hepatitis, but they'll be lessened in severity. And similarly, the patient with chronic hepatitis may not have jaundice, so it can create issues with diagnosing during the prodromal or the acute phase.